Seminoma Cancer. What is chemotherapy treatment? Imagine a treatment that uses powerful medicines to target and destroy cancer cells in the body. That's what chemotherapy does for seminoma, a common type of testicular cancer. Seminoma is known for being very sensitive to these drugs, making chemotherapy a highly effective option. When cancer has spread beyond the testicle, or there's a higher chance of it coming back after surgery, doctors often recommend chemotherapy. The most common chemotherapy regimens for seminoma include combinations of drugs like cisplatin, etoposide, and bleomycin. This combination is called the BEP regimen. Sometimes, doctors use just cisplatin and etoposide, known as the EP regimen. These treatments are tailored based on how advanced the cancer is and the patient's overall health. For early-stage seminoma, especially when the cancer is confined to the testicle, options might include close monitoring, single-agent chemotherapy with carboplatin, or even radiation therapy. Chemotherapy is usually reserved for cases where the cancer has spread to lymph nodes or other parts of the body. In cases where the cancer has spread to larger lymph nodes or more distant areas, chemotherapy with BEP or EP is often recommended. For larger lymph nodes, especially those over 3 centimeters, chemotherapy is preferred. For smaller lymph nodes, radiation might be considered, but chemotherapy tends to be more effective for more extensive disease. When the cancer is more advanced, such as in stages 3 or 4, involving widespread spread, doctors typically recommend multiple cycles of chemotherapy. Usually, patients receive 3 to 4 cycles, but recent studies suggest that 3 cycles can be just as effective as 4, with fewer side effects. One thing to keep in mind is that bleomycin, part of the BEP regimen, can sometimes cause lung issues, so in patients with lung problems, doctors might choose the EP regimen without bleomycin. After completing chemotherapy, patients undergo regular checkups, including physical exams and imaging tests like CT scans or PET scans. These scans help monitor for any remaining cancer or signs of recurrence. Sometimes, residual masses remain after treatment. If these masses do not shrink or stay active, further evaluation with PET scans or surgery might be needed. Overall, chemotherapy for seminoma has an excellent success rate, with cure rates exceeding 95%, even in advanced stages. The specific treatment plan depends on the cancer's stage, the patient's health, and potential side effects. It's important for patients to work closely with oncology specialists who are experienced in reproductive cancers to ensure the best possible outcome. This approach aligns with current medical guidelines, emphasizing personalized care that balances effective treatment with minimizing long-term side effects. Remember, always consult healthcare professionals for individual advice and treatment options.